All right, long-term care insurance training on hospice care. Now, this is an important thing to understand because since I've been billing long-term care insurance, I've taken on and I provide services for a lot of hospice clients that the hospice company is coming in and providing care, and we are providing home care services in conjunction with or in combination with the hospice company. So let's talk about that. Hospice care, what is it? Hospice is a covered expense covered by Medicare if the person receiving hospice is eligible for Medicare, that is. For example, when my mother-in-law was sick and was on hospice, she was 60 years old, so she was not yet eligible for Medicare. So Medicare did not pay the bill for services. It was a private pay for Medicare for the hospice services. So if somebody has a long-term care insurance policy and the policy in it states that if the policyholder goes on care and is receiving hospice services, the elimination period is waived for hospice services. So it's important to understand what they're saying there. Now, hospice, like I said, hospice is covered by Medicare. It pays very well. Basically, they're going to pay up to probably 100% of everything that bills out as long as they're Medicare eligible. But for cases like my mother-in-law, hospice comes in and they cannot bill Medicare. If they have a policy, a benefit that pays, let's say, $5,000 a month, but they have a 90-day elimination period, well, chances are they're not going to make it through their 90-day elimination period because they're on hospice and they may die within a very short period of time. So the long-term care insurance company has this rider in there that basically states that in the event that the policyholder goes on hospice and the hospice bill is not covered by Medicare, then the policy will then begin to kick in and pay for those hospice services specifically, not the home care and the home health services. So the policy holder won't be stuck with the cost of having the hospice services come in. So let's give you an example. I've had a client come home from the hospital with a home health care only policy. Hospice is coming in, they're providing hospice care, Medicare is paying the bill. However, they have a 42-day elimination period. Those 42 days that we are coming in and providing care, those are custodial-based care needs, and that day-to-day activity is not covered by Medicare. It is not a hospice expense. So the policy will not pay for my services until the 42-day elimination period has been satisfied. So in summary, if you have a policyholder that's going on a hospice and has an elimination period of 90 days, they are still subject to the elimination period for the services we provide. The policy Medicare is going to be paying for the services if they're Medicare eligible, and so the long-term care insurance policy is not going to be paying for any of that care unless they are not eligible for Medicare. At that point, then from the beginning, the elimination period is waived and the policy will pay the policy benefit amounts for the hospice services, not your services as a home care or a home health agency. You are still subject to the elimination period for the home care and home health services that you provide.